Good afternoon, everybody. My name is Audrey Morse Gasteier. I'm the Executive Director of the Massachusetts Health Connector. Together with my colleague, Mike Levine, who's the Assistant Secretary for MassHealth here in the Commonwealth, we're looking forward to presenting to you today and answering any questions you might have and hearing your feedback as well. We want to thank everyone for the time today to learn more about this monumental redetermination effort and for all the support of the employer community that has been made available to the Commonwealth and our various health coverage initiatives over the years, and we know will be the case to come as we head into this next effort. Before we get started and get into the presentation itself, just a couple housekeeping items. Everyone joining the calls had their audio and video muted. And following the presentation, just want to note we'll leave time for questions and answers and feedback. My colleague Erin Ryan will be facilitating that, so don't hesitate to use the Q&A feature to ask your questions throughout, and Erin will help facilitate those towards the end of the presentation. And just want to know we are recording the session today just to help out people who are interested in joining but weren't able to. So I think we can go ahead and get started. Okay. So what we're hoping to cover today is to walk the employer and broker community here in Massachusetts, leadership from those communities, through a really significant health coverage transition effort that we're about to be undergoing as a Commonwealth, and that's happening around the country as well, as you may have heard. And this is the redetermination of an immense number of people who are currently on MassHealth coverage, our state's Medicaid program. So Mike will be talking you through that as a part of this presentation. But really big picture, we just want to start the presentation by noting the key role that the employer and broker communities here in the Commonwealth play, and the fact that Massachusetts does in fact have the best in the nation health coverage rate. Mike will walk through the redetermination process itself, provide some background on why it's happening right now, what that will look like, how MassHealth has been getting ready to carry this out, and kind of the mechanics of what the process will look like. I will walk you through some of the work the Connector's been involved in to prepare for this transition, and our readiness to enroll people who will be losing MassHealth over the course of this redetermination project. And we'll cover some of the ways that the employer and broker community here in Massachusetts can help with this effort. And we'll leave some time, as I noted at the end, for questions and answers. So as I noted, we would be remiss if we didn't start with kind of the foundational statement that the employer community here in Massachusetts have been vital partners to the state whenever we think about health coverage expansion in Massachusetts and how Massachusetts did arrive at its best in the nation coverage rate of 97%. A lot of you who are on the call, I've been working with for over a decade on a lot of this work. And I just want to express my personal gratitude and the gratitude of the Commonwealth as we think about how critical of partners, employers, and brokers have both been through state health reform implementation, federal health reform implementation. Really at every turn that we've taken steps to expand coverage or secure coverage for people here in the state, employers have been partners and have really gone above and beyond in their efforts to make sure people in the state have access to high quality, affordable coverage. There's no other state in the country I would rather be in large part that's due to the fact that the business community here has been such vital, creative, and committed partners. So that is a key part of why we're turning to this community again to ask for your assistance, your insights, and your leadership as we head into this next period, as we'll get into. Stating the obvious, employer-sponsored coverage is really a bedrock of the coverage landscape that we have here in the Commonwealth. About 3.7 million people in Massachusetts have employer-sponsored insurance. That's ticked down a bit during the pandemic. We'll talk about that, how some of the numbers have shifted around between different coverage sources over the course of the pandemic with growth, of course, in the MassHealth program. But it is nevertheless the case that employer-sponsored coverage is a key source, a plurality of coverage for folks in the Commonwealth, and plays a vital role there. We know that employers and brokers have always played a key role in making sure people understand their options. And again, that's really led us to the really strong position that Massachusetts is in terms of coverage. You've been vital, not just in offering coverage, but educating people, educating employees and others in the business community about what's going on, how changes affect them, how they can help stay covered, and that's been critical. We know employers and brokers are effective and visible and trusted communicators to their employees about coverage options and benefits, and we'll need to tap into your expertise and your trustworthiness here in this process that we'll be walking through today. So it really is the case that the Commonwealth is once again looking to the employer and broker community for your help, your insights, your leadership as we do enter this next process. So here I'm going to hand it over to my colleague Mike, who will talk us through the MassHealth side of the world, what's about to happen, why, what it will look like. So Mike, I will be your slide driver.
Thanks, Audrey.
Sure.
Hi, everyone. Good afternoon. As Audrey said, my name is Mike Levine. I'm the Medicaid director here in Massachusetts, and it is great to be speaking with all of you because, as we'll talk about, I think a number of people who are currently on the MassHealth caseload will be transitioning over the course of the next year to the Health Connector into employer-sponsored coverage. So I want to provide a little bit of context on what's been happening the last couple of years that has resulted in a growth in the number of members covered by MassHealth, and what's going to be taking place over the next year. So as you may or may not know, the Families First Coronavirus Response Act back in early 2020 was passed by US Congress. It directed states to, by and large, keep everyone on their Medicaid caseloads. And again, MassHealth is the Medicaid program here in Massachusetts. In return for keeping folks on Medicaid, states received more revenue from the federal government in order to support the cost of covering members. As a result of, we've continued to gain new members, but not disenroll members. Our caseload has grown significantly from under 1.8 million to over 2.3 million residents of Massachusetts. That's about 1 in 3 people who live in the Commonwealth. And again, many of these people who have come onto the caseload, would have lost coverage at some point over the past 3 years, but again, we're protected by this federal requirement. Now, the requirement ended over the weekend on April 1st. And we are, returning to something that kind of resembles business as usual as it did before March 2020, where, if someone is determined not to be eligible for MassHealth anymore, then they would be directed to the connector to see if affordable subsidized coverage is available. But for many individuals, the best choice may be to take up employer-sponsored insurance that is offered to them. Audrey and I, when we present to groups, I think we always say at the outset that maintaining universal coverage is the North Star of all the efforts that the state is undertaking here in close collaboration with our partners. We are doing everything we can at MassHealth to make sure that if you are eligible for MassHealth, you keep your MassHealth. I'll talk a little bit about what that involves. But then Audrey's going to talk through everything we're doing to ensure that for those people who, and we think there may be about, we may see about 300,000 people come off our caseload. Those people can find affordable coverage that's right for them and their family. So Audrey, if you go to the next page, I'll talk a little bit about what someone needs to do in order to preserve their coverage. So, this is a marathon, not a sprint. MassHealth is going to renew members over the next 12 months, starting this month through next March. And if you think about it, we want to spread this out evenly over the course of a year. So we're going to be picking up and renewing about 1/12 of our caseload every month. Some months higher, some months lower, but that's roughly what we're trying to do. And wherever possible, we will automatically renew a member. If there's a federal income data set that confirms that person has income below our income threshold, they will be automatically renewed for MassHealth. If someone has another benefit through whether it's a federal benefit or a state benefit that automatically qualifies them for MassHealth, we will automatically renew them. And for about half of our members, that's what's going to happen. But we think there might be about half of our members where we need more information from them, and we're not going to be able to automatically process their renewal. So if that's the case, if a member's renewal cannot be automatically processed, then they are going to get a blue envelope. Don't have a prop with me, but I like to hold them up in these conversations. And basically, we're telling our members, keep an eye out for a blue envelope because it has a renewal form in it that we need them to fill out. and respond to us, or they can mail it to us, they can go online and give us the information, they can call us, lots of ways for them to get in touch with MassHealth. But basically they have 45 days from the time they get the blue envelope to submit the requested information so that they get the best health benefit they qualify for. In many cases, they'll still be eligible for Medicaid. In many cases, they'll be eligible for a subsidized plan on the connector. And in other cases, they won't be eligible for either of those. And that's where employer-sponsored coverage is going to be a really important path. If we get information back and we see that someone is no longer eligible, then, again, we'll point them towards the connector and towards other sources of coverage. If we don't hear back from a member, if we send someone a blue envelope, but 45 days go by, we will not be able to extend their coverage. And they will get a termination notice saying that, 14 days from receipt of this notice, your MassHealth coverage will end. There is what I like to call one more bite at the apple, which is this 90-day reconsideration period you see described on the bottom of the slide, where for someone who did not respond, in the 3 months following their termination, they have a window to, again, call, email, send back the blue envelope, and we will reinstate their coverage back to the day that they lost coverage if they are still eligible. So even if you miss your window, you don't respond to the blue envelope, in that 45-day window, there's a 3-month time period afterwards where you can get your coverage renewed back to the date that you lost it. So that's what members need to do and need to think about as we get ready for the redetermination process. And Audrey, if you go to the next page, I'll just spend a minute describing some of the steps that MassHealth and the state have taken to get ready for this. Again, the goals across the top of the page are that we don't want people losing coverage because they missed their blue envelope. That's the worst outcome. If you're eligible for MassHealth, we just need some information from you. We want to keep you on the caseload. We also want to make sure, number 2, that members understand what they need to do. And 3, there are quite a number of federal and state regulations and requirements that we need to stay in compliance with. In order to achieve those goals, there are a number of things we've done. I'll kind of go around the wheel at the bottom of the page, starting with implementing system changes in the upper right. We've made a series of enhancements to our systems over the past 3 years that are actually going to increase the number of people who get automatically renewed by removing some steps in our system that have tripped applicants up historically on their way to being renewed. When we go around counterclockwise, we've also increased our operational capacity. We have far more, nearly double the number of customer service representatives and eligibility workers. And we are going to continue to ramp up over the course of the spring because we know that we have more members than we've ever had. And so we're going to get more calls, we're going to get more renewal forms, we're going to get more applications. We've really staffed up ourselves, and we've staffed up through grants a number of community-based organizations who can assist members with applications. There's an outreach strategy, which I'll talk about on the next page. And then finally, this piece around supporting complex renewals is really important. There are some populations that MassHealth covers that has a more complicated renewal process. For instance, adults over the age of 65, individuals with disabilities, individuals who are homeless. And we are doing our best to go the extra mile to find those people, meet them where they are, and ensure that they have the support that they need to get through the renewal process and land in the right benefit. So I think I have one more page before I hand it back to you, Audrey. And it's this one, which is just talking a little bit about our member outreach efforts. So generally speaking, there are 3 messages we are trying to convey. The first is we are asking people, and we've been asking people, to update their contact information. We want to make sure that when we send a blue envelope, it gets to the right address. Number 2, we want people checking their mail. We want them keeping an eye out for this blue envelope. And number 3, we want them responding to MassHealth. We have already developed and distributed materials describing this initiative and what members need to do in 9 of the top languages that our members speak. I think it's really important to note that we are launching a text and email campaign. For instance, when you get a blue envelope, you're also going to get a text. You're also going to get an email. We know a lot of people don't get their mail every day. So it's critical that we're reaching our members through multiple modalities. I mentioned that we are developing supports for specific populations who we just know, based on having done this for decades, have a harder time filling out the MassHealth renewal and extending their coverage. We are partnering closely with a fantastic organization here in Massachusetts called Healthcare for All, which is going really deep in about 15 communities across the state where we have the most members at risk of coverage loss. They are knocking on doors. They are investing in local media. They are supporting local community-based organizations. They're doing everything they can in these specific geographies to make sure members know about this. And finally, we're growing the certified application counselor workforce. Again, these are people who are on the ground in your community, places where members go, who can help them with renewals. So lots going on. And again, our effort is to make sure that every member on our 2.3 million caseload knows what they need to do in order to find their way to the best benefit. And I'll hand it back to Audrey to talk about what happens when someone is ready to transition to the connector.
Sounds good. Thank you so much, Mike. So as Mike noted, going to be a lot of transitions, potentially confusion, need for information from folks going through this on the MassHealth side of the world. Most of these individuals being renewed will land back in MassHealth coverage, which is a good thing, but there's going to be lots of people for whom MassHealth no longer is what they qualify for. So the connector is kind of the natural landing place for a lot of these individuals. And it may also be the case that employer-sponsored coverage is a natural landing place, is where a lot of these folks make sense. So I'll walk through some of the ways the connector is getting ready to intake, presumably a pretty significant population of folks coming off of MassHealth, what we're doing to get ready, what we're doing to communicate with those folks, and then we'll get to how this might intersect with the employer-sponsored space, which may be another avenue for a lot of these individuals. And we'll really look for your partnership and help in making sure anyone coming off MassHealth knows about any and all options available to them. The connector is an option for everybody. ESI, employer-sponsored coverage, may be an option for some people. So we'll really look to you all to help us make sure people understand those options at kind of an individual and business level. So the connector, just to kind of establish, I think folks on this call are generally aware, but just want to kind of baseline. The connector is the state's official health insurance marketplace or exchange. So we're where people from anywhere in the state can come and apply for health coverage. As Mike noted, lots of people do qualify for subsidized coverage through the health connector, but many of our enrollees are people who don't qualify for any subsidies, just pay out of pocket. They're people who don't qualify for employer-sponsored coverage. That can include sole proprietors or people who work in the contract space or any number of other reasons. They might not qualify for ESI. A good walking around number for understanding about the connector's scale and size is we generally cover about 250,000 people. Our numbers are somewhat lower now because of this public health emergency we've been in, where nobody's been able to come back to us from MassHealth. And that's kind of been a normal part of the connector's enrollment profile. So we're a bit lower than usual right now, but just wanted to kind of baseline what the connector is. We're available to anybody who doesn't have another source of coverage in some way, shape, or form. So as we get ready for this transition and know that folks that will be losing MassHealth eligibility, the connector may be the right place for them. Just from a scale perspective, in terms of what we're anticipating, it's difficult to predict with precision how many people will end up qualifying for health connector coverage or in fact enrolling in it, but we're preparing and expecting for somewhere between 100 and 200,000 people to come to the connector from this process that MassHealth is undergoing. This would be the biggest enrollment shift or growth for the connector since the implementation of the Affordable Care Act, so pretty significant coverage transition. And this is really a topmost priority for the connector for this year and going forward, because we do want to make sure we're a key ingredient to making sure the Commonwealth doesn't take any steps backwards in terms of our overall health coverage rate here in Massachusetts. So just at a very high level in terms of how we've been preparing, and this is consistent with what Mike described on the MassHealth side, but operationally preparing for volume. So that means everything from our contact center to our navigators, which are organizations we partner with at the community level to provide enrollment assistance to folks. So really just getting ready for more people to need the connector, have questions for the connector, et cetera, over the next 12-month period. A very, very strong outreach presence. You'll be seeing and hearing from the connector a lot over the next 12 months. And that will include all kinds of media and community-based activity to make sure people know that we're here, what we're available for, et cetera. So the outreach and communications piece is a significant part of this. And then also consistent with Mike, really taking a look within our systems to try to figure out if there are easier and more streamlined ways for people to maintain their coverage and enroll in coverage if they are making this transition over from the MassHealth side of the world. Just to kind of have things located in one place for people who are looking for information about the connector's role and about the redetermination process writ large. We've got a link down here where we're kind of housing all of this information for people on our website. So I don't know if Erin, you can pop that link into the chat just so people have that handy, and then we'll talk about this, but there's sort of a corollary landing page coming off of this. It's for the employer community specifically. So we'll talk a bit about that as well. So getting into kind of how you'll be seeing the connector taking steps to bolster public awareness about coverage options available through the connector. We've talked about how this is really going to be a significant number of people we think will be newly in need of health coverage through the health connector. And so this will be really one of the most significant undertakings in the last decade or so for the connector. So you'll be seeing the connector on TV, on radio, digital platforms, et cetera, really just wanting to make sure we have a very amplified voice for people who are going through this process from MassHealth. I'll talk in a moment about the more individual level communications, but since this is such a significant endeavor for the Commonwealth and we want to make sure nobody falls through the cracks, we're pairing this kind of broader macro level communication and outreach strategy with an individualized, tailored approach to individuals who'll be losing MassHealth coverage. This campaign being available in many languages is a key priority for the Commonwealth because we want to make sure there's no populations that are left behind or less communicated to. So you'll be seeing all kinds of information and outreach in a variety of different languages. And in terms of the messages we're actually putting out there to people, certainly just making sure people understand what the Health Connector is, that we are this kind of next logical place for coverage for people who may in fact lose MassHealth. Reminding people we have an individual mandate here in Massachusetts that never went away, even when the federal individual mandate came into play with the Affordable Care Act. That is still in the books. Adults in Massachusetts are expected to carry health coverage. We know people in the Commonwealth already really value and want to have coverage. So we don't need that to be a particularly heavy-handed stick, so to speak, but we do want to remind people it's important to take action quickly to secure a next source of coverage if they do lose MassHealth. We don't want people kind of gambling with their health or their financial protection and waiting to see if something happens. And the individual mandate is sort of a helpful nudge to have in the picture to make sure people know to move quickly so that they don't face a tax penalty. And then reminding residents not to Google around for health coverage. We've seen an uptick in recent years of people when they do lose coverage, whether it's through a job or something else, that may do online searching for affordable health coverage options. And we've seen a lot of people get tripped up in what I would call scam or non-compliant plans that don't meet state or federal standards for coverage. Sometimes people were looking for Health Connector coverage and Googled it and ended up getting sold something that was absolutely not Health Connector or any state regulated product and end up with huge medical bills and all kinds of issues. So we want to use this opportunity of transition to remind people to come to the Health Connector's website to really understand what it is they're looking for and to make sure it's really us that they're interacting with online and not just to Google around, because we've seen the effects of that. A few other notes about ways that we're engaging at a community level to bolster awareness and make sure people have the resources they need to enroll in health coverage through the connector. Lots of in-person visibility and outreach. This is very consistent with the work the connector does every year during the open enrollment period. And so this is community events. You'll see posters and literature and small businesses and other locations at the community level where we know we get good visibility and are able to bolster awareness from that perspective. We'll be doing enrollment events around the state, and we'll be posting information on our website and elsewhere so that you and others in the business community know about these when they're coming to your area, but we'll be holding those in all corners of the Commonwealth throughout the next 12-month period. Really working to make those as accessible to people as possible. So, including activities for kids and families if people need to come and bring their children along with them, and really just trying to make those as accessible as possible for people who want to sit down with an assister or somebody who can provide them with direct application assistance if they have questions or need that extra support. We have bolstered capacity in our Navigator program. For anyone who's not familiar with what that is, Navigators are organizations that are specially trained and certified by the Health Connector to provide community level enrollment assistance to people in lots of different languages all around the state. So that's been in existence for a long time. But we have added a number of new navigator organizations, particularly in the Boston area, and added some new resources into the navigator program writ large, just with the expectation that there will be this influx of enrollment and need over the next year. So we have listed here the link that you can share with employees and others about how to find a navigator or an assister in their community. They're a really vital resource, and they speak 28 different languages, so lots of support available to different folks across the Commonwealth in that regard. And then lastly, we're also launching a pilot program. This is with financial assistance contribution from our partners at MassHealth. And this is effectively a set of mobile outreach teams that will be traveling around the state throughout the redetermination process at pre-scheduled locations to provide in-person assistance, again, to people who really need to sit down with somebody, understand their options. And this is kind of a nice, flexible, novel way for us to provide that assistance above and beyond the Navigator program, above and beyond the enrollment events I've just described. And these will be traveling again to kind of pre-scheduled locations that we'll do promotion about in the area. So people know we're coming, but just as an example, we would be visiting places like pharmacies and town halls and libraries, food pantries, kind of high traffic places where people can know that they can pop in, for example, on a Thursday afternoon if we're going to be slated to be there for a few hours. So we're excited to do that and kind of roll that out as a pilot, as kind of an additional layer of kind of a belt and suspenders approach to our overall outreach presence across the state. So that's kind of the big picture, macro level and community level supports that we're planning to put forward to make sure we're transitioning people effectively from MassHealth to the connector. But then that will be paired with, as I mentioned, this individual tailored level of communication. Massachusetts has many tools that I think we feel fortunate to have going into this period that many other states don't. One of them is the fact that we have an integrated eligibility and enrollment system that is shared by MassHealth and the Health Connector. And one of the ways that advantages us heading into a transition like this is, as soon as somebody loses MassHealth coverage, they find out simultaneously that they can enroll in Health Connector coverage. And because the system shares all the same data, the connector will be able to tell people, looks like you lost MassHealth, looks like you would qualify for, connector care plan or whatever it might be for that particular individual. So that we think will really behoove the effort to move people from point A to point B, because we can tell them exactly what it looks like they qualify for, exactly how to enroll. It's not really these two siloed programs that somebody has to come and separately apply for example. So that is going to be a key tool that we use. So people that are losing MassHealth will be hearing from the Health Connector as soon as their eligibility changes and flips over in the system. And so they'll be hearing from the connector in kind of a multi-channel capacity that will include snail mail, email, robocalls, outbound calls, and text messages. So we're really using kind of an all hands on deck approach to the communications that we'll be sending out to people. So people will be hearing from us very frequently. We don't want it to feel like harassment, but we will be very persistent with people because we really do not want people to fall through the cracks. Okay, so that's kind of the waterfront in terms of everything the connector will be doing to raise awareness among people losing MassHealth about their options through the Health Connector and trying to move people from point A to point B. But there's this other population or group of individuals for whom employer-sponsored coverage may be an option. Maybe they had employer-sponsored coverage before and their circumstances changed and now they would be eligible again, or they got a new job during this period and they are in fact eligible for ESI, but because they've been on MassHealth this whole time, they haven't needed it, but they will now. So we want to make sure we're taking special care as a state and as a healthcare community to make sure that the employer community and the brokers who work with them have the tools they need to make sure that you're able, for people who do qualify for ESI, to get those folks onto that plan if they do lose MassHealth coverage. So that's a key area of focus for us. And we want to make sure you have the tools we need to do that work effectively and as easily as possible for you. So when we think about opportunities for the employer and broker community to help with this overall effort, again, coming back to, as Mike noted, our North Star is to really maintain our 97% coverage rate or go erosion in our coverage levels here in Massachusetts. So we're looking to the business community to help make sure It's spreading awareness to employees who may be on MassHealth to respond to that blue envelope. I know Mike didn't hold up the specific one, but you can picture it. It's a nice baby blue color. But really, you may not have information about exactly who's on MassHealth, but if you have populations of employees, just making sure they understand that if they are on MassHealth, they may be receiving these renewal notices in the mail, and that it's vital that they respond to it. Because if they can continue to qualify for MassHealth and that's the appropriate place for them, then that's really important that they're doing that to secure that coverage. And if not, that they're getting the most accurate, updated eligibility from the system. So spreading awareness to the workforces that you work with, that the employers and brokers you work with, is going to be key. And I think that message coming from the business community, compounded with the messages they're hearing from MassHealth itself, they'll be hearing from carriers, they'll be hearing this in their provider settings, they'll be hearing from the connector, but the business community is really going to be key and a trusted, highly visible, kind of high touch contact point that these folks have. So any work you all can be doing to make sure that people are hearing that message from their employer themselves, I think will be key. For people who do lose MassHealth, we want to make sure that they're aware of the 60-day window that they have to enroll in employer-sponsored coverage. That's a standard kind of HIPAA window that people have available to them. So steps that the business community can be taking to make sure people know that they need to take action quickly, and they do have that window available to them if they are in fact eligible for employer-sponsored coverage. It may be the case that for some people who it looks like may qualify for subsidized coverage through the Health Connector, they may need to confirm in their application to the connector that they don't have access to affordable employer-sponsored coverage. So the connector has all kinds of information on its website about this, but some of your employees may need information from their employer about what it would cost for them to be on employer-sponsored coverage if it's in fact the case that it exceeds the affordability kind of standard under the Affordable Care Act, which is 9.12%. If an employer-sponsored coverage offering exceeds that, then it's not considered affordable for the purposes of the employee, and they can therefore qualify for federal tax credits. So it may be the case that you need to help people get onto ESI. It may be the case that people have questions about what ESI would cost them, so they can figure out if they should be in that or if they should be in subsidized plans. So again, the employer and broker community kind of being ready for questions like that over the next 12-month period will be really important for us. And for brokers, I think just an expectation that there could be an uptick in activity as your client groups need to get people onboarded into ESI if that's what makes sense for them. Again, in kind of this general work to build awareness among employees, and doing that work to get them on to the roles if that makes sense for them. And again, encouraging people not to delay, and that it's really important not to have gaps in coverage. All the reasons I'm sure everybody on this call knows that that's true. And I think the business community will be a really important voice in reminding people that we do have this continued individual mandate requirement to carry coverage here in Massachusetts. We don't want to see employees being faced with a tax penalty because they had a 6-month gap in coverage, that kind of thing. So to the extent that that can be a message that's ensconced in the information that employers are pushing out would be really appreciated. The connector, I'll kind of list this out on, I think it's the next slide, but we've tried to put together kind of collateral and different materials and assets that employers and brokers can use as a part of this educational push. So you can see here, we've put together some employee-facing resources that are kind of turnkey and easy for employers to use. So you'll see one here, and we've translated these into Spanish, Haitian Creole, and Portuguese. So that's all posted on our website. And generally speaking, I would just say, kind of heading into some of the other resources we've created to try to make this as easy as possible for the employer community. This is what we've started so far. So we have launched a special website, a special URL off of the Health Connector's website that's for employers, where we are hosting a few different resources we're hoping might make this work easier for you. We've got an FAQ up there. We have kind of a template newsletter blurb that for chambers and associations who are on the call, you can kind of plug and play, put in your newsletters and emails that go out to your membership. Just trying to make that a little bit easier for you all. and a flyer for your workplaces and employees, again translated into a few different languages. We'll also be including information on that webpage whenever we're hosting employer-facing events. This conversation we're having today was kind of a kickoff, and our intention was to really be speaking with the associations and chambers and leaders in the business and broker community, and we're so grateful for you joining us today. We're also planning to host monthly or so webinars with business owners themselves and HR professionals and anyone else from the employer and broker community that's looking to learn more and get informed and engaged on this topic. We'll be holding our next such one on May 17th, but you can check back to this website that you're seeing here for information about those kinds of webinars and other resources that we'll continue to post. So I'll pause there and say, this is what we've done so far. We see this as the beginning of a conversation with the business and broker community. Other resources that you would find helpful, I think we're all ears. We'd like to know how we can make this easier for you. We know this is an unusual event and ask of the business community, the broker community, and we really want to make this as easy as possible in general, but also, again, in the spirit of partnership and appreciation for how much work the employer and broker community have done since really the dawn of time in Massachusetts. When we think about expanding health coverage, you've been partners to us at every turn. So we're really looking to you for your questions, certainly, but also your ideas. How can we make this go more smoothly for you, for the businesses you work with? What kinds of resources, materials, support from the state? We're here at your disposal. We want to make this as easy as possible for you. So we'll welcome your ideas, in the Q&A function today, but also please don't be strangers in terms of ideas you might have. If you wake up tomorrow with another idea or 6 months from now, we want to hear about it because we want to help make sure we're supporting you and making this as easy as possible for the groups that you work with. So I'm going to pause there, and I think we can open it up to questions. And again, I would just note, interested in your questions. Mike and I will do our best to answer them. Anything we can't answer, we'll find the answer to, and we'll include it in the FAQ that we have on our website. We'll track down anything we need to, and we'll just be continually updating that. And I know on our employer URL, we also plan very shortly, I think by the end of this week, to have a form that employers can submit questions through. So this is not your last opportunity to ask questions, and we'll just be continuing to update the resources and the FAQ on the web page to make sure we're getting any questions you or others you work with may have as we enter this period. So I'm going to pause there, and I know Erin, my colleague Erin Ryan, is happy to facilitate any questions that have come in. So Erin, I'll turn it over to you.
Great, thank you so much, Audrey and Mike. So we will continue to monitor the Q&A box, so please ask questions as we carry on. But can you please start with just reviewing the timeline to add employees to the employer-sponsored plans, and then maybe helpful to also review the timeline that an individual who receives the blue envelope will go through?
Sure. So I'll start with the employer side of the world, and then Mike, if you want to just kind of review the timeline for what individuals on MassHealth might see. So there's a 60-day window that somebody has if they lose another source of coverage and are, as a default, eligible for an employer-sponsored plan. So it's 60 days from the loss of that coverage. So might keep me honest here, but say somebody were to lose coverage from MassHealth on June 1st, they would have until August 1st or thereabouts, depending on the specifics of the way the calendar months fall, to enroll in that employer-sponsored plan. So that's just that key window for employers to be aware of. You may not know that somebody that works for you has lost MassHealth. So I think that's where it's going to be really important for employers to be very communicative with their employees to say, if you've been on MassHealth and you're losing it, you have 60 days to enroll with me if this is a person who's in fact eligible for ESI. If it's not, then it's a different conversation about pointing them towards the Health Connector. But if it is a person that's eligible for ESI, you would want to make sure that they knew that they had 60 days and to come and work with you or your HR department or whatever would make sense for you. But Mike, I'll ask you to take the other part of the question, which is just sort of the time lapse between somebody getting a renewal and depending on what they do, what the timeline looks like.
Yes. So again, we will at MassHealth, we are going to try to automatically renew our members. But for those that we cannot automatically renew because we don't have enough information, we will mail them, and I got this prop in the meantime, we will mail them a blue envelope, which will look like this, and it has a response required language to try and grab folks' attention. And members have 45 days from the time that they get the form to respond to us. And so I think, Audrey, in the example you shared where someone loses coverage on June 1st and has 60 days to get over to a ESI plan, I think the example here would be they get this on April 1st. They have until May 15th to respond. And if we don't hear from them in that time, then they'll get a termination notice that gives 14 days heads up prior to termination on June 1st. So again, you get this envelope, you have 45 days to respond. If you do not, then you get a termination notice that gives you 14 days advance notice that your enrollment will be closed. And from there, that 60-day clock to jump over to an employer-sponsored plan begins.
And I thank you so much, Mike. And I think it's a really good question, and there's a lot of different timelines to keep track of. And I wonder if maybe Erin and team, we can take back a few illustrative examples of those kinds of timelines might be good for us to include in the FAQ or in some other capacity on the employer resource page.
I agree, Audrey, because we have another question that kind of aligns with the timeline, but specifically when how employer coverage should be treated from a retroactive standpoint. So for example, if an individual were to lose MassHealth coverage on June 1st, but they don't notify their employer until maybe several weeks later or the end of July, is the employee required to enroll retroactively to June 1st, or how do those dynamics work together?
So I would think that that person may want to ask their broker or a carrier that they're working with on that. I don't believe there's any obligation to retro enroll that person in ESI. I think that window is about the person's ability to take an action that would then allow them to enroll in the employer-sponsored plan.
Great. And then another question that we've received are there any predicted impacts on the merged market as a result of this transition, utilization and cost versus experience with current subscribers?
That's a good question. I don't think there are any particular impacts, but for growth. I think you could think about this as essentially reconstituting, re-implementing the way the market looked prior to the pandemic. So people who, it doesn't make sense for them to be in MassHealth, they don't qualify, that would have otherwise been in not just the merged market, but in large self-insured plans. And there's not really a particular rhyme or reason to, I would say like the risk profile or any particular characteristics about that population. People who underwent economic changes in 2020 and thereafter. I mean, that was a pretty wide-ranging economic event that the Commonwealth and the whole country experienced. So I don't believe there's any reason to think that there will be particular impacts from a premium or other perspective. This is really about people sorting back into parts of the market that they organically would have been in had it not been for these particular coverage protections that were specific to the pandemic.
Great, thank you. And how would an employer determine if the coverage they offer is affordable or not?
So there's some resources on the Health Connector's website that I think we could kind of fold into that employer FAQ that could be helpful. It's difficult for an employer to know specifically whether something they're offering is considered affordable to their employee. And the reason is because when we talk about affordable, there's a particular federal definition for it for the purposes of whether an individual worker can qualify for subsidized coverage under the Affordable Care Act. So again, it's indexed, so it's sort of a random number, but right now it's 9.15% of their household income. If it exceeds that for self-only coverage that's considered not affordable, in which case that person, even though they're offered ESI, can qualify for a plan that has a federal tax credit applied to it. The problem for an employer that makes it tricky to know that is they may not know their employees' total household income because it's not just tethered to their particular salary or wages. They could probably make some informed guesses, but they wouldn't know for sure unless they had, the broader household's tax information, which they just wouldn't. And so the information really needs to get to the employee for the purposes of them determining if the offer from the employer is affordable to them or not. So again, I think we can braid that up into kind of a rolled up piece of information that could be helpful to employers because it's a good question, but it's a little bit trickier than meets the eye for that reason.
Great. And so the employer resources and that webpage that you referenced, Audrey, is that something that's appropriate for chambers to utilize as well to get out to their membership?
Absolutely. So we have this website that we set up, and there's a few different resources there that we went over. The FAQ, there's an employee kind of flyer or employee facing resource, this newsletter blurb. The whole website is absolutely fine to share with businesses through chambers or other associations. We really encourage you to, we urge you to. We want to get this message out to as many employers as possible. And then there's also, I think if you put it in the chat, Erin, there's a kind of a page that's not specific to employers, but just to residents and the general public. Feel free to share that as well. But all kinds of resources there, hopefully helpful both to businesses and employees themselves. Again, as you look at that, as chambers, as association leaders, please look at it, share it, but also tell us what's missing, tell us what else you need, and we'll build it.
Great. And I think kind of hand in hand with that last thought, why is it important for employers to be involved in this process?
It's a fair question. So it's important because you're proven. The business community in Massachusetts has been incredibly effective partners whenever we've needed to change something up in the way we approach coverage in Massachusetts. We could not have done it successfully without the business community. So I will just say that as someone who's been involved in some of those steps along the way. So no good deed goes unpunished, but we need your partnership here because, as Mike mentioned, this is 2.3 million people in the state. This is 1 out of every 3 individuals that lives in the Commonwealth of Massachusetts that will be going through this redetermination process. They may not all get the blue envelope that Mike held up, but they'll all be going through this process in some way, shape, or form. And so we really need every facet of public life that is interacting with these individuals to make sure they understand that they have to take action. Massachusetts has a lot of great programs set up and a wonderful employer community to protect people and get them into a next source of coverage if they do lose it. But we need people to take action. This isn't just going to happen on its own. People can't just automatically get into a health connector plan. They have to pick a plan and pay a premium. They can't automatically get into an employer-sponsored plan, even though they qualify. They have to let their employer know and have their employer facilitate their enrollment. And so we need the voices of the employer community to help make sure people know what to do and how important it is and incumbent it is on them to take an action. And again, that can be information sharing and just raising awareness among employees. Even if an employer doesn't offer ESI, that's fine. There's still a role for you to play here, just making sure people know this is coming, what to do, how to get into connector coverage. And if it's the case that employers can help by onboarding people into ESI they qualify for, that's great. But there's no way we could do this without the business community and the broker community. It's going to be a major coverage event. We need your partnership because your employees trust you and they look to you for information about their benefits, even if they don't get their benefits from their employer.
Great. And we received another question about affordability and with respect to affordability for an individual versus affordability for an entire household and recent changes in the law that might be helpful to understand.
Sure. And we can add more information to our resources for this as well, but just kind of at a high level, people may have heard, I'm trying to remember exactly what month this happened. It might have been last fall, but there were changes in federal ACA rules. There's something referred to as the family glitch that did not make a differentiation between whether an individual worker had access to affordable employer-sponsored coverage or their dependents also did. And so there were some updates to the rules there that have made it so that more dependents will qualify for tax credit subsidized coverage through marketplaces by looking to see if the family's coverage, if the coverage for the dependents is also considered affordable under those ACA standards, not just the individual worker themselves from a self-only coverage perspective. So it's a really positive change. It brings more people into the ranks of subsidy eligibility, but it is a slight change in kind of the mechanics of how the application itself works. So again, not something I would expect an employer needs to know or navigate, but they do need to be able, because again, they wouldn't know what that person's broader household income information is and whether they would fall on either side of affordable, not affordable, for the self only or for the whole family. But what would be important for an employer to know and do is put information in front of their employees to say, hey, you should check out whether you qualify for, my coverage as the employer or subsidized coverage, and which one makes sense for you. And if the coverage offered by the employer isn't affordable under these standards for the worker or their family, then subsidized coverage would make sense. So those resources are important, but again, not something I think the employer would be able to figure out on their own and then inform the employee of.
Thank you. And another question has come in. Will there be any changes to the MassHealth Premium Assistance Program? Is this still available?
So premium assistance has continued through the pandemic and will continue into the future. We think it's a terrific way for our members to affordably access employer-sponsored coverage and look forward to continuing it.
Great. And I am just going to ask, will this material be shared with all of the attendees? And I know we're recording, so that is of interest to our attendees.
Sure. Yes, we are recording this. We'll be posting this webinar on our website. I think we may also do the same with the future webinars that are for the broader employer and broker community as well. So there'll be resources up on the webpage, and I think we can share the slides as well. I don't see any issue with that. So the resources will keep coming onto that webpage.
Okay, and we have an additional question that just came through. Do we see any potential new employer assessments similar to EMAC of a few years ago that might come out of part of this transition or anything along those lines?
No intention, nothing of that sort. Just really looking for the employer community's partnership and raising awareness and making sure people land in the coverage source that's right for them.
Yeah, nothing. There certainly was nothing to that end in the governor's budget for FY24 that was released weeks ago.
Great. Well, I will pause a moment because we do not have any additional questions. So if anyone wants to add any questions to the Q&A functionality, we have about 7 minutes left.
And even if not, I would just reiterate, and I know I speak for Mike, our deep appreciation both for your time today and really just for the continued leadership of the Massachusetts employer community. Just again, such a vital partner to the state's objectives and interests in making sure all of our residents have coverage. And we just see you as such essential partners in this work, and even just the response to some of the outreaches we've made over the last few weeks and starting to send out some of these materials. The eagerness of this community to help and to kind of ask how they can be assisting and contributive to the process is so encouraging and so consistent with what we've seen at every turn from the employer community in Massachusetts. I wish you all were in every state. We're just really fortunate to have you all as partners.
Great. And one last just clarifying question on the availability of the slide deck. Will this be something that we send via email to attendees, or will it be posted more broadly, potentially to the Health Connectors website or mass.gov?
I think we can share it. Let's plan to share it with people. I think we have the email addresses of folks who joined today. I'll leave that to my more technical friends, but could certainly share it that way. And I think we can share it on the website as well, but there's nothing secret here. I'm just looking to get information out to everybody who's willing to join us in this effort. Anything else? I think, Erin, it seems like we've exhausted the Q&A.
We have. So if you guys have any last thoughts you would like to leave everyone with, I will leave it to both of you.
Okay. Yep, I think just again, our deep gratitude for joining today and for the partnership we know we'll be able to enjoy with you over the next 12 months. And so more to come from us. You'll see follow-up from us directly. Please keep checking that website. Please push this information out to folks in your associations and your chambers. The more and the louder and the earlier the better, so that everybody knows this is coming, because as Mike noted, the switch flipped over this last weekend, and we're anticipating in the coming weeks and certainly in the next month or two, the activity level really picking up in terms of people, starting to see terminations and changes in their coverage status. And that's when we'll really need the partnership of the business community to make sure people know what to do next. So we appreciate that. And I would, again, just reiterate, as you're looking at the resources we've pulled together, what we've covered in this conversation, please think about what else you need that you think would be helpful to you or to employers and brokers that you work with. We're all ears. We want to be as helpful as possible, making resources that are turnkey and make your jobs easier, because we know we're asking a lot of you. So thank you. Anything else from Mike?
No, just echoing your thanks. Really appreciate the attention and the focus on this over the next 12 months.
Thank you, everyone. We'll be in touch.
Thanks.